Indian Dental Association of Tiruvalla branch is presenting you with yet another power-packed information video on mouth ulcer and cancer awareness with the theme of Better Mouth, Better Life. Hi everyone, this is Dr. Mayakha Mariam Mathew. Today in this video, we will be talking about mouth ulcer. What is a mouth ulcer? A mouth ulcer is basically a painful sore that develops in the inside of your mouth. They are seen on the gums, your tongue, your inner part of your cheeks, your lips, and the roof of your mouth, that is your palate. You will usually see it as white or yellow patches that will appear on the lining of your tissue. Now let's see what causes mouth ulcers. So usual and very common thing is vitamin deficiencies that you see in children or younger adults. And another thing is when you cause any form of injury eventually lead or become a mouth ulcer. So that might include like harsh or abrasive brushing, biting your tongue unknowingly, or even sometimes your ortho braces will cause a mouth ulcer because of constant trauma or injury to your tissues. Now, another factor is like hormonal changes that you see in females during the menstrual cycle, and very common that you see in exam-going students and parental adults. They are undergoing a lot of stress, which will definitely cause mouth ulcers. So apart from this, the mouth ulcers have been linked to serious health conditions like diabetes, immune disorders, and any disorder that is affecting your digestion, like inflammatory bowel disorders, celiac diseases, and even like other blood disorders like Behçet's disease, and most commonly your HIV and AIDS. Now, how long does it take for a mouth ulcer to cure? So usually it has to resolve by themselves within 10 to 14 days, maximum 2 to 3 weeks. And if it does not, you definitely have to go visit your dentist. So meanwhile, we'll look at what are the home remedies that you can do for your mouth ulcer. So the very first thing is to drink plenty of water. You definitely need a lot of water to boost your immunity back on track. And another thing that you definitely have to do is maintain your oral hygiene. The rule of thumb is definitely to brush your teeth every 12 hours, that is morning and before you go to bed, so that you make sure you're keeping your mouth clean and out of bacteria. So apart from this, you can use warm salt water to rinse your mouth at least few times a day. Now let's look at the treatment of mouth ulcer other than your home remedies. So the best thing that you can do is apply antiseptic gel on the ulcer. So this will help you do your daily activities like eating food or even brushing your teeth without pain, because antiseptic gels, what they basically do is numb that mouth ulcer so that you are not in pain. But definitely when you are brushing, try to avoid traumatizing that area again, or even while eating food, try avoiding hard food and even spicy food in that area. So when should you actually see your dentist? So if your ulcer basically lasts more than 3 weeks or longer, then you have to go to your dentist and see what the problem is. If you develop a fever or even if you have diarrhea along with your mouth ulcer, then it should be something larger, and this is where your dentist comes in, because as the famous saying goes, you have to treat the disease, the root cause underlying, and not the symptoms that is being shown. So thank you for watching. Hope this video presented by IDA Tiruvalla was definitely helpful for you.